I'm with Ahmad Ma'ali from the St. John's Eye Hospital here in Jerusalem. Now, Ahmad, when was the eye hospital started here in Jerusalem?
Well, good morning. The St. John of Jerusalem Eye Hospital started in 1882 to provide eye care to the people of the Holy Land. We started our hospital on the way to Bethlehem in a place called now Mount Zion Hotel. We moved from there into the old city in 1948, and we moved to this current location in 1961. Now, we have become a group of hospitals. So we have the Mother Hospital here in Jerusalem, and we have a day hospital in Gaza, we have a day hospital in Hebron, and we have a center in the north of Palestine called Anapta. Altogether, we treat close to 140,000 patients every year.
Wow. You've been here for over 137 years. There must have been a real need for something here, was there?
Absolutely. There was a real need for the eye hospital in Jerusalem, and I wasn't there, but I was told that patients used to come to us from Gulf countries, from Syria, from Jordan, on camels to come to the eye hospital. Pilgrims who came to the Holy Land, they contracted a disease called trachoma, and it was very prevalent in this part of the world. Actually, when Her Majesty Queen Victoria ordered to build this hospital, the main aim was to eradicate this disease. And we worked hard to do that, and in 1961, we declared Palestine and Israel as free of this disease.
Wow.
Yeah.
So you have royal connections.
We very much have royal connections. Yes, the head of the Order of St. John is Her Majesty the Queen, and our Grand Prior is the Duke of Gloucester.
Are you the oldest provider of eye care here in the Middle East?
Yes, we are indeed. We were the first eye hospital to be established in the Middle East, and we remain to be the only charitable eye hospital to provide eye care in the Holy Land as well.
Do people here lose their sight because of poverty?
People in this part of the world, the level of, if you like, visual disability and blindness is higher at least 10 times than that of the Western countries. There are many reasons for that. Poverty is one of the reasons, and also lifestyle. Almost 20% of the population have diabetes. Diabetes is not very well controlled, and as we all know, diabetes affects the back of the eye or the blood vessels of the eye, and therefore, without prompt treatment, this can lead to blindness. Now, poverty is one thing because accessibility to eye care is the main problem. Accessibility can be due to a number of factors. Not only, it can be a physical barrier. People are not able to move because of restrictions of movement sometimes. Poverty is another problem of accessibility because if you don't have the resources, the money to travel and to pay for your treatment, you are unlikely to provide sort of the seek eye care. But also there is a problem with knowledge and education. Unfortunately, some people feel that going blind or losing their sight is part of growing, becoming older. And therefore, we at the eye hospital, we try and sort of work with the communities. So we have a mobile outreach clinic that travels to places where people have no access to eye care. We have an ethos at the hospital that everybody comes to the doors of the hospital will receive eye care, regardless of their ability to pay, regardless of their race, religion. So we are very proud to keep this ethos. So everybody who knocks on our doors receives the treatment he or she deserves.
So people who go blind, are some of these cases needless cases that shouldn't have happened in the first place?
Indeed, there are a number of needless blind cases in Palestine, mainly cases to do with blindness related to, if you like, inherited diseases. First marriages, close marriages is a problem. I think the percentage is around 38% of the marriages are within the family, and therefore there is a consequence for that. I mean, a health consequence, but the eye is part of the body, and therefore many of these kids will develop diseases like cataract, like glaucoma, like dystrophies as a result of consanguinity. But also there are cases that people become blind, irreversible blind, because of diabetes, because diabetes is very aggressive kind of a disease in this part of the world, and it affects mainly the retina, and the retina is an extension of the brain. If it is destroyed by diabetes, it's very hard to recover that part of the retina, and therefore prompt treatment like laser treatment or other treatment must be on time, and ignoring or neglecting this will lead to blindness. So there are a number of cases we unfortunately see that are beyond our capability to resolve the blindness.
Is diabetes basically a case of a bad lifestyle?
It is, I mean, I'm not a medical doctor, but it is a bad lifestyle, but also it's consanguinity as well, and it's an inherited disease. It's a change of lifestyle. People in this part of the world, as I remember them, they were all laborers, farmers. Things have changed. Everybody has a car. Everybody used to have a donkey. People walked. People don't walk anymore. I think people eat unhealthy. I don't know if you've been to parts of the West Bank, like people like knafi. It's very sweet kind of food. Yes, some of it it can be prevented, but also some of it is related to family inheritance as well.
You travel to remote communities. Tell us a little bit about that.
Well, basically, we started this project in 1980, whereby we have a group of doctors and nurses. We have a van that leaves the hospital every day, 5 days a week, goes to the areas where there are no health services in general, but ophthalmic services in particular. For example, we go to the Jordan Valley, we go to refugee camps, and we treat 50, 60, 70 patients on each trip. We have very good relationship with the community leaders, and therefore we announce our visit like a month before, so people are waiting for us, and all of this service is provided to our patients free of charge. This includes also, in addition to eye care, health education and health promotion as well, so it's part of the package that we deliver sessions of teaching and training to patients, and sometimes even to healthcare workers about how to deal with visual problems and how to refer patients to the hospital. Altogether, we treat around 10 to 12,000 patients as part of this project, yes.
Does saving the sight of someone have a big impact on the family? Someone can now work instead of being a burden?
It is indeed. I mean, just imagine that you have a child who's like 2 years old, 1 month old, and basically he comes on time to the eye hospital. He or she has cataract, and basically you remove their opacity and you implant a lens in their eyes. Basically, you have given this child 70, 80 years of vision, and you've given this child the opportunity to go to school, develop normally, physically and intellectually as well, and hopefully when they reach the age of 17, 18, they will be an effective member of the community, and they are able to provide for themselves, to provide for their families. The alternative to that, this child will be blind, and he will be a burden on the family, and he will be a burden on the community and on the economy as well. So this is really just a simple example of cases where intervention of the eye hospital and of the eye doctors, if you like, on time does enhance the life sort of expectations of the person and their families, and also enhances the community economy as well.
Are you doing a work in Gaza, and how is the situation in Gaza?
We started our work in Gaza in the 1990s. We used to do outreach mobile clinics there. We established our center in Gaza in 1992. We provided eye care to Gaza until 2016, when we built our own hospital in Gaza. Now we have a 4-story building in Gaza, a hospital where we provide mainly daycare services. We perform close to 2,000 surgeries in Gaza, and we treat close to 40,000 patients in Gaza. The Gaza situation, as we all know, is very complex. We have tried to reach a stage where we are self-sufficient in Gaza. So we have provided the equipment, we have provided the training for our staff. We still need to go to Gaza to support the staff there, but we have a very well-established day hospital there, and we do have good relationship with the Israeli authorities, whereby we are able to send our medications, supplies, if you like, to Gaza regularly in normal days. But as we know today, or in the last few weeks, the situation in Gaza hasn't been normal, and therefore we have not been able to deal with supplies, etc. But we are not at a critical stage, because we have planned for these days, if you like, and we have enough supplies already in our stock to continue working with the patients. The main problem in Gaza is poverty. Nobody from the patients is able to contribute to their services. Therefore, most of the services that we provide is charitable work in Gaza, and also the lack of, there is a lockdown. Let's be honest, there is a lockdown in Gaza, has been there as borders for the last 16 years. And therefore, access to Gaza is not easy. As I said, we do have good liaison with the authorities, and we are able to travel there with very little difficulties. It's difficult for our patients to come from Gaza here. I mean, in the last 3, 4, 5, I think 4 months, we didn't have one single patient coming from Gaza. In one way, it's good. In one way, it's bad. It's good because that really we have made the provisions to provide almost all services in Gaza. I'm not saying all, but almost all. We still need to have certain patients, maybe a number of these patients would be 20 a month, to come over to Jerusalem to receive more sophisticated services here, especially surgical services. But unfortunately, because of the lockdown and other political and security problems, none of the patients has been able to travel. So Gaza is somewhere that we would like to invest more. We would like to have Gaza as self-sufficient as possible and to be able to provide service. As you know, there are 2 million people in Gaza. And there's another eye hospital in Gaza, which is a governmental hospital. But I can tell you with confidence that what we provide is at least 10 times more than that eye hospital, despite the fact that we have maybe 1/3 of their staff because of problems of training, problems of equipment they have, and also they don't have the resources. For example, if you want to perform a retinal surgery, it's very expensive. All disposables or medical disposables are disposables, and basically you use them once. The cost is high. It reaches something like $600-700 just for the medical equipment that used for that surgery. And therefore, other hospitals and healthcare providers in Gaza don't have that resources. We, thank God, have. And therefore, we take care of almost 60%, 70% of eye care in Gaza.
Now, your roots are a Christian organization. Do you treat all religions?
Indeed, our mission is to provide eye care to everybody who comes through our doors, regardless of their religion, race, creed, and ability to pay. This is a Christian organization, was founded on the ethos of the Order of St. John, or the Night Hospitalers. The Order of St. John started some 900 years ago. It is, as I said, it has a Christian origin, but we employ Muslims, we employ Christians, we employ Jews, but we treat everybody, regardless of their religion or ability to pay. And I think the harmony the hospital presents, I think in Palestine in general, but in this hospital, whereby you have, for example, 30% Christians, you have 69% Muslims, but we have 2 Jewish doctors. They don't work regularly, but 2 Jewish doctors, they come to us. In many ways, this is a good example how the 3 religions can work together to provide humanitarian care.
How important is the hospital to the community?
The hospital is very important to the community. If you think about, to start with, how many people we employ 270 staff. And with the extended families, these people look after families, big families. We invest in Palestinians. I'm an example of that. We have, before, until 1990s, every single doctor almost, and every single senior nurse, and the CEO, and everybody else were expatriate staff. There was a decision made whereby we decided to invest in people, in the Palestinian local people, and therefore we trained our doctors, we invested in our nurses, sent them to England, to Israel, to India, to Egypt, and now we have a highly specialized, trained staff. And as you know, this is part of being part of the community as such, in the sense that, we all know doctors are leaders in the community. And if you invest in these people and you invest in your ethos of being humanitarian, you're translating that into the community. Not only that, the hospital has been here since 1882 as the main charitable provider. If you think about how many people have come through the doors, if you go to any part of Palestine, I bet you speak to somebody that say Mustashfa al-Uyun in Arabic, or the eye hospital, everybody knows. Everybody has been affected by the eye hospital, positively, I hope, in the sense that either directly or indirectly, or they know somebody, a neighbor or member of the family who has been to the eye hospital, or parts of the hospital, like the satellite centers and hospital group. I think the eye hospital has been very instrumental in raising the standards of eye care. We train doctors in the hospital. They come from the community, they train, they go back to the community. We train nurses to become eye nurses. We've trained something like 160 nurses. So basically they come here, they train for 1 year, we look after them while they're training, and then once they finish, they go back to the community to look after eye patients. The same with doctors. We have 6-7 doctors now training. They finish their residency, which is a 4-year training. Once they finish their 4 years, we might employ 1 person but the rest will go back to the community. There are about 130 doctors. I mean, I hope people will not object to be saying that. Doctors as ophthalmologists in the country, at least in the West Bank, I would like to believe that almost 90% of them came through the doors of St. John, either directly or indirectly. Either they trained here, or they were part of the hospital staff, or they have come here for a short period of training. So this hospital has been an integral part, an essential part of the community development for the last 137 years.
Do people come back to you with stories of how you've saved their sight?
People do come back to us, and we do see this in the hospital as well. I mean, people come to us almost blind. I mean, hopefully their blindness is reversible. Sometimes, unfortunately, it's not reversible, but we operate on patients, and the success rate is very, very, very high. I'm very proud to say that. And people are very emotional after you remove the eye patch, if you like, from their eyes. I'm very thankful, and I mean, this is why our nurses and doctors stay here for 30, 40 years, because there is a reward, and most people get this firsthand from the patients and from their families. So yes, I think we are making difference to the lives of the people, and our people, as you know, they are very grateful.
Now, you have a picture on the wall of Prince William. He got to see the organization. Tell me how that was.
Yes, indeed, this was a very special visit by His Royal Highness, who visited Jerusalem, and because of our royal connections, we made a request for His Royal Highness through the palace to come and visit us. So he kindly agreed, and he spent about 30 minutes at the hospital, the Muristan, where the Order of St. John started, and he was extremely impressed with what he's seen, and he saw Amin, and he also inquired about the work of the hospital and, about our funding and all of that. For us, this was a very important, prestigious visit from the royal family, which shows that the royal family is still very much interested in the work of the hospital. And we had the pleasure, of course, of joining him at the British Consul General residence, and we talked about the eye hospital and the work of the eye hospital, and for us this was a very special visit.
Why do you do what you do?
Why do I do what I do? I tell you that I have been in part of this hospital for 30 years. Surprise. I worked in England, I worked at Moorfields, I worked other parts of the world, mainly England. This is a special place. I mean, people ask you why. It is special because I think we are a good employer. I mean, we have British, let's say, European standards in the sense of employment law. Employment law, I feel that we are a very fair, transparent organization. People come to us because of that. And also, if you look at the hospital, what we have achieved, we moved from a small hospital in Jerusalem to become a group of hospitals. We are, unfortunately now, we are filling the gap that the Palestinian Authority cannot do because of the backlog of cases. So the impact of what we have been doing on the lives of the Palestinians, and as a Palestinian I say that, is huge. It's a very rewarding job. Again, as I said to you, we are royal in the sense that we are connected to the royal family, and Her Majesty the Queen is our head of the hospital. We also attract people from European countries to come and work with us as volunteers, and they see firsthand the impact of this hospital on the lives of the people, especially the poor Palestinian patients who come from isolated areas. This hospital is about bringing light to darkness. And I personally, as I said, I worked at Moorfields and I worked in other places, but people have everything. I'll give you an example. If you work in England and you want the patient to go home, you just call the transportation and they come and pick up the patient, send him home. He has nobody to look after him at home. You send to him through his general practitioner, the district nurse, to look after them. Here you have to do everything. You have to think about the patients, the family, the aftercare, the before care. The patient doesn't have the resources. So this is a very holistic approach to providing first-class eye care in a very third world kind of context. For me, this is very rewarding, and I have been the CEO only for the last year. I think I have made a lot of changes. I have made positive changes, and I feel that we still can do more to support our people and to support the ethos of this hospital. and enhance the standards of eye care. One thing I didn't mention, that we were the first hospital in Jerusalem to receive the Joint Commission International Accreditation. I cannot see it on the wall, which is an American accreditation of quality in hospital care. It's not a certificate that's given. It is something that you receive after a massive inspection of a whole week. They go through all your standards of care, and we were the first eye hospital, thank God, to receive that. We were re-accredited again last year. We're due for re-accreditation in 2021, and that shows, despite the fact we are a charitable hospital, we rely heavily on donations, but we have maintained and excelled, if you like, in standards of care, which is something usually is quite difficult to have. Poor resources and excellence in care, but we have managed to have these sort of two concepts married together.
What's your website for people who'd like to know more about the hospital, or perhaps even give a donation? What's your website?
Our website, we have a website. I mean, I think the easiest thing is if people just go to Google and just write St. John Eye Hospital Group, go straight to the website. And the reason I'm saying this, it has been under construction for a while. It is looked after by our team in London. I think, last I know, it has been now launched again. But basically, if you Google St. John of Jerusalem Eye Hospital Group, you can go to the website, you can see our activities, our patients, our stories, and of course, if people would like to donate to the eye hospital, they will be able to do that online as well.
Okay, Ahmad, thank you very much.
Thank you very much, Paul.